All right, welcome back to ABA Exam Review and the continuation of our BCBA exam series where we're going through another set of practice questions together and breaking them down. If you're new to the channel, welcome. If you're returning, welcome back. Please subscribe for all of our updates. Check out behavioranalyststudy.com for all of our study materials, including our combo pack. When you pass your exam, let us know so we can include you in the Sunday shoutout. Work hard, study hard. Let's get going. Lauren missed her normal cup of coffee this morning because she was running late. It is now 1 p.m. and Lauren is scrambling, trying to find a cup of coffee as quickly as she can. Missing her morning cup of coffee functions as a blank relative to Lauren at 1 p.m. So we've got a behavior question, and when we're dealing with direct behavior questions, we want to think about two things. Who is the person of interest and what is the behavior of interest? Because in a lot of your scenarios, you'll have multiple people and multiple behaviors. In this case, we're looking at missing a morning cup of coffee relative to Lauren at 1 p.m. So we're concerned with the missing the cup of coffee and how it's affecting Lauren at 1 p.m. What is the function of that missing coffee relative to Lauren? What do we know about Lauren? We know Lauren missed a coffee because she was running late. So at 1 p.m., she is scrambling, trying to find coffee as quickly as she can. Now, why would Lauren want to find coffee so quickly at 1 p.m.? Well, she missed her normal cup of coffee. So what has happened to the value of coffee? It's gone up. And what typically increases the value of something? When we talk about the value of something increasing, we're talking about motivating operations. In this case, Lauren was deprived of her cup of coffee, which increased the value of that coffee. So missing the coffee functions as a what? A, negative reinforcement. Why is this not a negative reinforcement question? Well, because missing the cup of coffee is an antecedent. Reinforcement and punishment are consequences. Motivating operations are antecedents. Missing the morning cup of coffee happens before Lauren at 1 p.m., so it can't be a consequence. So we can't pick A or B. So it has to be either an establishing operation or an abolishing operation. With an establishing operation, we are increasing the value of something, which typically evokes behavior. With an abolishing operation, we're decreasing the value of something, which typically abates behavior. In this case, what was established? Well, the cup of coffee. And since the cup of coffee was established, what did Lauren do? Well, she started scrambling for the coffee because she was deprived in the morning. Pretty straightforward motivating operations question. If you got it right, fantastic. If not, that's okay. Slow down, review, and consider how deprivation and how satiation are related to our motivating operations. Roman and Kendall are fighting over who gets to play with Legos in the playroom. After asking a couple of times for them to stop, their mom finally tells them that neither one of them gets to play with the Legos and that they need to find something else in the playroom. What does this intervention resemble? This is kind of an interesting question because there's a couple key ideas here. We're looking at an intervention, so we're trying to choose an intervention of the mom's choosing and what she's using with these kids. We have Roman and Kendall who are fighting over the Legos in the playroom. The mom tells them to stop, which they don't. And then when they don't stop, she says, well, you don't get to play with the Legos, but you need to find something in the playroom. So what has the mom done precisely? She has prevented them from playing with the Legos, but they're still in that same setting. So what do we call that? A, exclusionary timeout. With an exclusionary timeout, you are removed from the setting. Roman and Kendall were not removed from the setting. They were put in timeout from Legos, but they were not excluded from the playroom. So this would be a non-exclusionary timeout. They're not excluded from the setting. They're just in timeout from the Legos in that same setting. With C, a partition timeout, you would put some sort of barrier or something that is separating the learner from the reinforcement and the setting or whatever that reinforcer is or whatever the timeout is related to. And then a timeout ribbon, you're either going to give them a sticker or some sort of marker, some type of ribbon that indicates timeout is in effect. The mom has not done that. All she's done is told the two boys or the two children, you are not allowed to play with the Legos in the playroom, but we're staying in the playroom, find something else. She hasn't excluded them. She simply put them in timeout using a non-exclusionary timeout procedure. Liz, a behavior analyst, is scheduled to conduct parent training on Tuesday with a family that desperately needs help with a punishment procedure. On the day of parent training, Liz has an emergency and is unable to make the training. Liz reaches out to one of the technicians who works with the client and asks the technician to conduct the parent training instead. Is this acceptable? Put yourself in the shoes of Liz. Liz is the behavior analyst in this case. And remember, as a behavior analyst, your role really is training and supervising and managing your team. You're creating these plans, you're training on these plans. So you're going to have to make a lot of tough decisions as to how you're going to handle your cases. In this case, Liz, the analyst, is supposed to conduct this parent training with the family that desperately needs help with punishment. So punishment is always tricky. There are ethics involved. There are a lot of side effects of punishment. So it's going to be a very important parent training. On the day, though, there is an emergency and she can't make the training. Things happen. So what does Liz do? She tells one of the technicians to conduct the parent training instead. Is that okay? Are technicians, RBTs, allowed to conduct parent training? Let's start there. Yes, RBTs are allowed to conduct parent training. It isn't their primary role. They should not do it without permission and training, but they are allowed to. So Liz is able to pass those responsibilities to the technician. Now, are there other things Liz needs to consider? Because what if this technician had just passed their RBT exam and this is their first week with the client? Would that be acceptable? Well, it depends. And what does it depend on? So is this acceptable? A, no, technicians should not conduct parent training. Technicians are allowed to. Technicians can conduct assessments. They can conduct trainings. The important piece, even with us as BCBAs, is that we have the competence and the training to do it. That's the important piece. B, no, Liz should not cancel with such short notice. Well, things happen. Life happens. Is it ideal? Of course not, but sometimes it can't be avoided. C, yes, as long as the technician is competent and trained. That is the stipulation. As long as this technician can be trusted, they're competent, they know the plan, they are more than welcome to do the parent training. Should Liz follow up? Should she keep an eye on it? Absolutely. But if they're competent and trained, there's nothing wrong with it. And then D, yes, technicians are always allowed to parent train. That is not true. Some technicians should never parent train. Technicians shouldn't parent train without supervision or permission. In this case, the thing Liz needs to be worried about is that technician competent and trained? If they are, then this is acceptable. A behavior analyst requests to observe their 10-year-old client in the classroom setting. The teacher and the school both approve and allow for a 30-minute observation session. The analyst notices during the observation that the teacher, who is not a behavior analyst, is not conceptually systematic and is implementing various punishment procedures without reinforcement. What should the analyst do? All right, let's slow down. As always, let's focus on the question, okay? There's a lot going on here, so let's make sure we're understanding the question because we have to figure out what the analyst is going to do in the situation. We know the analyst observed a 10-year-old in the classroom. The teacher in the school approved the observation for 30 minutes. So that's great. During the observation, the analyst noticed that the teacher, who is not a behavior analyst, which is important, is not conceptually systematic and is implementing punishment. Now, we know as behavior analysts, we are required to be conceptually systematic when delivering behavioral services. What about people who are not analysts, who are not BCBAs, who are not BCABAs? They are not bound by our same rules and codes. So you want to be very careful when collaborating that you are aware if someone is or isn't a BCBA. Because if they're not, you are not to hold them to the same ethical code and guidelines that we abide by. You're not to hold them to the same task list. They go off of different rules. They go off of different policies. So if we have this teacher who's not being conceptually systematic and is implementing punishment, well, guess what? That is not our business because this is her classroom that we are observing. So what should they do? A, pull the teacher aside and point out their concerns. Not unless the teacher asks, right? Because it is not your place as the analyst to tell the teacher how to handle her classroom. It'd be the same if the teacher came to observe you. You wouldn't want the teacher questioning what you were doing unless you asked for their opinion. B, request a student be removed from the classroom. No, nothing in the question indicates anything is wrong. It's just not conceptually systematic with our principles. C, discuss these things only if asked directly by the teacher. Yes, only if the teacher reaches out and asks for your opinion or your feedback should you discuss these things. And even then, we have to do it in a collaborative nature. And then D, inform the parents that the teacher is not working well with their child. Again, there's no indication. Just because she's not doing what we're doing doesn't make it wrong. ABA, while very powerful, very effective, and what we practice is not the only way. And that's very important in collaboration to remember. So, what should the analyst do in this situation? They need to discuss these things only if asked directly by the teacher. Lynn is at a trade show to promote her candle making business. On her table, she sets out 5 candles, and as patrons walk by, she asks them to smell each candle and pick their favorite. Then, whatever candle was the favorite remains on the table while the other candles are removed and new scented candles are put on the table next to the favorite candle. What does this scenario resemble? So, we have a preference assessment question because Lynn at her trade show is asking preferences for these candles. So, what does Lynn do? Well, she sets out 5 candles and then she asks the patrons, smell each one and pick their favorite. Let's say they pick this one. What does Lynn then do? She puts this one back and then replaces the other 4 with different candles. So what type of preference assessment does that resemble? And notice how we kind of thought it through, because on your exam, you're going to get a lot of application questions, most likely, where you might have to think a little deeper, where it's not just all clinical ideas. That's why it's a great idea in your day-to-day life to apply everything you're learning and start thinking through, well, what fits here behavior analytically? Now, what does this resemble? Is it a single choice preference assessment? Well, clearly not, right? We have 5 candles to choose from. That's not single choice. What about forced choice? With forced choice, we would have 2 candles to choose from. We have 5. What about multiple stimulus with replacement? What do we mean when we talk about with and without replacement? Well, exactly that. We have 3 or more stimuli, and then when a stimulus is selected, we either replace the other stimuli or we don't. In this case, we are replacing the stimuli that was picked, the stimulus that was picked, and then we're putting it back on the table and then putting 4 new ones. So this is going to be a with replacement preference assessment. Without replacement, the item that was picked would just be removed altogether, and we would ask again. So this scenario resembles a multiple stimulus with replacement preference assessment.